Mercy Health's mammography van will be traveling to various care facilities all across the Mahoning Valley throughout the month of February, removing barriers and giving every woman the opportunity to be screened. We have Laura Boomhauer, who is the community health educator at the Joni Abdu Comprehensive Breast Care Cancer Center and manages the mammography van. She's joining us with more. Laura, good morning.
Good morning.
So why is Mercy Health's mammography van such a necessary resource for our community?
You know what? It's such a convenient. We try to make it the most convenient way for women to get their mammograms so that they can't say that, I can't get here. We go to all of our locations in 3 counties and all of our family practices. So we make it easier for them to get their mammograms every year.
That's such a huge deal. And I want to know what technology does the mobile unit offer?
We do a 3D mammography in our van, just like we do here at the center. So it's up to date. We only do screening mammograms on the van. So if you have any other issues, you'd have to come here to the center for an ultrasound or MRI or anything like that, or diagnostic. But we do the screenings the same with the same equipment that we do here at the center.
That's amazing. This is the first mobile unit in the region to offer 3D mammography, and it allows for a more thorough breast examination. So it's cutting edge what you guys are doing. Now, what's the response from the community? Are people taking advantage of this resource?
They are. In addition to our family care practices that we go to, we also go to community events. We go to churches. We've gone to several businesses in the area that offer it for their employees. So we try to make it as convenient for everybody as we could.
And I know a lot of people, if they're thinking about meeting you guys at one of your locations as you travel around this February, they want to know about insurance. Are most screenings covered by insurance providers?
Yeah, most insurances have it under their preventative care. So, there's a majority. Very few insurances nowadays don't cover screening mammograms.
So I think it's important to tell people the risk factors of not getting screened or just putting it off until next year.
Well, you know what? Caught early, breast cancer is could be preventable. Caught early, the outcomes are so much better. If you wait and you have a lump or something or any kind of change in your breast, and you wait, the longer you wait, the worse the outcome. So that's why we like to, encourage women to get their screening mammograms every year. And if they feel something, immediately call us so that we can get you in and get you taken care of quickly and for the best outcome.
And a lot has changed with these units. I know fear sometimes keep women from going to get screened. They think it'll be painful. What do you have to say about that?
You know what? The 3D mammogram doesn't seem to be as painful as the old 2Ds. They don't have to press as hard, it seems. A lot of women are saying that it's not as uncomfortable as it used to be. But you know what? You also, it lasts for such a short period of time, and it's so worth having done that, the short amount of time that little pressing down feeling, it goes away quickly. Yeah. But again, the 3D is not half as bad as the old 2Ds used to be.
That's good to know. So tell us, how do we find out when the mammography van will be in our neighborhood?
We have it posted on our website at mercy.com. And if you go to one of our primary care locations, you can always ask your physician when it's going to be there. And we also say if you have a physician in Boardman, you can always go to any of our other Mercy Health locations. You can just call here at the center. We'll schedule you.
All righty, Laura, thank you so much for joining us this morning and sharing this potentially life-saving information for someone. We appreciate it.
Thanks for having us.
Of course.